The last topic for today, and this one is pretty interesting, and I see this in my own plastic surgery practice, is the increase in people wanting to remove breast implants. This is something that has actually, I've seen visually grow in my practice over the years. Now, I'm going to tell you that breast augmentation surgery continues to be one of the most popular plastic surgeries in the United States. It's actually number 1 or number 2 each year. There's around 400,000 done every year in the United States, which is a pretty big number. I do think that overall they're really good surgeries when you look at things like satisfaction rate, easy recovery, low risk. I do think they are good surgeries. However, we have seen a pretty significant increase in the number of women who come back and want to have breast implants removed. And so, that's not too shocking because, if you have breast implants put in, they don't last forever. So at some point you're going to have to make the decision, do I want to swap them out for a new pair or I just want to take them out? So
why don't they last forever?
Just like anything. I mean, it's like cars don't last forever, computers don't last forever, our clothes don't last forever. Medical devices are the same way.
How long do they usually last?
That's a great question. So it depends on if they're silicone or saline. Saline ones last usually at least 10 or 15 years. The new generation silicones are lasting a really long time. I think probably they're going to push 30 years or more.
Wow.
The old silicone implants of the past were lasting, 20, 25. So these things have, a pretty good lifespan to them, but they don't last forever. And so when they finally kind of give out, you have to do something. So what was more common in the past was for people to just swap them out for a new pair. And what we're seeing is the number of people, when they get to that point where they have to do something, they're actually taking them out versus replacing them.
How would someone, if someone got a breast surgery, how would they know that my breast implants are broken?
That's a very good question. So in the past, the way that we knew that is you would start to get scarring in the breast and that breast would get harder. And so people would be like, oh, something's happening. And a lot of times that meant that they were having a rupture. Now, that was for implants that were older or saline implants. Nowadays with the new generation silicone, it's harder to tell because if they rupture, they don't necessarily cause a lot of problems. And a lot of people, I think, wouldn't even know if the implant did rupture. But when people go and get things like mammograms or CT scans for other reasons, a lot of times those radiographs or x-rays will show, oh, there's something going on with the implant. And then they'll get a report on that, and then they will say, oh, well, I have to go to a plastic surgeon to get that fixed.
That's interesting.
Yeah, so that's how people know. So the number of people who are deciding to go with implant removal versus implant replacement is actually going up, and it has over the last 15 years. And like I said, I've seen this in my practice. I would say in a given month, I get anywhere from 2 to 4 consults for people that want to remove their implants, which has gone up. That's a bigger number than I saw 10 years ago for sure. And so the question probably pops up, okay, well, why is this? You're going to answer? Go for it if you think. Yeah, no, I know the answer, but if you think you know, go for it.
Maybe it could be since some people who have bigger breasts, they have more back problems, and let's say someone has a flatter chest and then they get breast implants, they could be wow, this kind of hurts my back. I don't want to do this.
You're spot on. I mean, that's pretty darn accurate. So that's actually on my list here. So it is very common for, as we age, that we put on a little bit of weight. That's normal. It's a normal thing. And so for women, when they put on weight, some of it will go to their breast. And so what I've seen happen many, many times is someone gets breast implants when they're young and they're really petite and they're thin, and they get these breast implants, and then over the span of 20 or 30 years, as people tend to do, they put on weight and their breasts get larger and larger and larger to the point, just as you said, that it starts to become uncomfortable. And so there are plenty of people that exactly for the reason that you stated say, you know what, my body's changed, I don't need these breast implants anymore. And so they take them out. Another reason that somebody might do it, and I find this to be less of a reason, is for if they've had complications with their surgery. Historically, breast implant surgery is pretty low complication rate, but you know, there are risks of things like scarring or infection. And so if people have had a bad experience with them, they may come to the conclusion that they want to remove them. I've had that happen
That makes sense, yeah.
Yeah, I've had that happen from time to time where, you know, somebody comes in and they're like, look, I just have had problems with these since I put them in. I'm not interested in trying to, you know, fix it. I just want them out. So that does happen. There's two more reasons. One, change in desire for what people want to look like. You know, I mean, you know, I feel like I want to look a little bit different now than I did 20 years ago. Women are the same thing. You know, when women are young, they might be like, oh, I want to have these, like, you know, larger breasts. And then as you age, like, your desires change.
Yeah.
And so that's another reason why people change over time. And so some people just want to have them out because they want to have smaller breasts when in the past they want to have larger. And then the last one, which I doubt you've heard about this, maybe. Have you ever heard of the breast implant illness?
I think
I'd be surprised if you did.
Once, like maybe like one time scrolling on TikTok, but I don't know anything about it. Yeah.
Travis, I know we've talked about this. You've heard about this, right?
Mm-hmm. Yeah, I know we've talked about it
before. So in a very, very small percentage of people, we're talking less than 1% that get breast implants, they have these kind of vague symptoms that they attribute to the breast implants. And there's never been really a direct link shown that the implants are causing it, but there is studies out there that show that if you have those implants removed, that those people will feel better. And so we don't see a huge number of people here in Texas that have it. I've taken out one set of implants for somebody that had breast implant illness. I had another person that had a consult for it just to maybe find out what the data was on it. But it is a reason. You see it in other places. It's a little bit more prevalent. So I thought I would talk about what is breast implant removal surgery like, because there are probably people out there that might be watching this segment and maybe they have implants and they're thinking about having them removed. So what is the surgery like? Well, it's pretty straightforward. We remove the implant in its entirety. So if it's ruptured, we make sure we get all the pieces associated with that. If it's not ruptured, it's pretty easy just to pull out. Then remove the capsule layer, which is that fibrous layer that forms around your implant. And that's the part that can sometimes scar and give people complications. So there's a lot of data out there that shows that you don't absolutely have to take that layer out. I personally do, just because I feel like it's better to heal if you have a fresh layer of tissue to heal together where that implant was versus that fibrous layer. So I always take it out. You will have drain tubes, so you do have to put a tube in that space where the implant was to suck everything together, to remove any fluid that comes in. The drains usually come out very, very quickly, so it's not like other surgeries where you'll have drains for weeks and weeks. They usually come out pretty quick, like in a couple days. Recovery is overall very easy for these surgeries. It's not a bad surgery as far as how much pain you'll have or having to take a long time off work. Overall, these do have very low risks. I can't think of anyone offhand that I've taken implants out that have had problems. I'd say they also have a very, very high satisfaction rate. For my patients I've done these for, across the board, I think they've been happy. The only thing to consider about when you're removing breast implants is what do you want to do to your breast, if anything, because if you take something large out of a breast, like a breast implant, the shape of the breast tends to get worse. It's just like the same phenomenon when women get pregnant and their breasts get larger and then they lose that weight and the breasts have a shape that's not as nice or as perky. The same thing happens when you remove breast implants. So for most people, they will remove the breast implant and then do a lift to reshape the breast and make it look nice. And so it's definitely important to have that in consideration. And so moving on to that, talking about tips for people that are seeking breast implant removal, I have some things I think are very important. First off, find a plastic surgeon. Make sure it's a board-certified plastic surgeon that does a lot of breast revision. There are plastic surgeons out there where they don't do as much cosmetic surgery, and they may do like one surgery like this every 6 months versus people like me who specialize in breasts who do it all the time. You want to find someone that's going to listen to you. I have had people come in who either wanted to have their breast implants completely removed for one reason, and after we discussed it, found out that maybe that's not what they wanted. Or I've had people that maybe wanted to just change out their implants that really didn't need them anymore. And so you want to make sure you find a plastic surgeon who's going to take the time to talk to you about what it is that you're trying to accomplish, because it's not the same for everyone. I'm also a little wary of people who claim to be breast implant removal specialists. That's not really a thing. There's no fellowship for breast implant removal. It's a marketing gimmick, and when people do marketing gimmicks, it always makes me wary. So, I mean, obviously you want to find somebody that does a lot of breast surgery or somebody who's done a fellowship in breast, but breast implant removal specialist is not a real thing. So, also finally, tips for avoiding being that person who would want to have their breast implants removed in the future. So this is for people who are thinking about having augmentations. First off, find a good, talented surgeon to do the augmentation, because people who do lots of these tend to have better outcomes, which means you're less likely to have complications. They're also more likely to talk to you about the potential downsides of getting really big implants, which if you get really big implants early on, you're much more likely to want to have them taken out down the road, or at least downsize them. And then the last one is, as Danica was talking about, is making sure your weight doesn't get out of control. If you gain a bunch of weight and you have breast implants, there's a very high likelihood that you think your breasts are going to be too large, and you'll be much more likely to want to have them removed in the future. And Danica, this is kind of a funny thing. What's the saying we say about breasts?
Sisters, not twins.
She heard me say that one time, and now she's running around her school saying that, and apparently like it's a meme at your school. Is that right?
Yeah, a lot of people say
And she wants me, what do you want me to do?
You should make merch.
She wants me to make merch
Merch
that says sisters, not twins.
That would be dope.
Which I think I'm actually going to do, because I think it'd be funny even if we don't get rich selling it. So, well, I think that might be all the time we have today. I want to thank you, Danica, for coming and being a guest co-host. I think you did an awesome job. You're great on camera.
Thank you.
Thank you so much for coming. Thank you guys so much for tuning in. We really do appreciate it. Please leave us a comment. We want to know what you think. Maybe we'll talk about what you want us to talk about next time on Nip Talk.